In my last video, I mentioned a little bit about probiotics, and let's talk about that today, just completely, because this is a question I get all the time. A patient comes to me and says, Dr. Okoro, should I be taking a probiotic supplement every day? So, should you be taking a probiotic supplement every day? Hi, I'm Dr. Ngozi Okoro, but you can call me Dr. O. I'm a board-certified gastroenterologist, and on this channel, I help you understand your gut and what it's trying to tell you. Whether you're feeling bloated, backed up, or just plain confused by all the health advice out there, I break it down in a way that makes sense and actually helps you. Every week, I'll share practical tips, research-based insights, and real talk to help you reconnect with your body, trust your instincts, and feel good from the inside out. So, if you're ready to reset your gut and reclaim your clarity, make sure to subscribe and hit that bell. Let's get into it. We're going to try and delve into this issue and see why you may or may not need a probiotic. So first of all, what is a probiotic? A probiotic is actually bacteria that helps your gut health, that keeps your gut healthy. Bacteria are microscopic. You can't see them with your naked eye, but there are certain foods and certain medications that are formulated in a way that when you eat them or take these medications, they deliver this good gut bacteria into your small intestines in amounts that help with your digestion. And so this is what we know for sure. What are these probiotic pills? I understand it's a billion-dollar industry, but here's the thing. We want to go evidence-based, meaning what are those probiotics that have actually been certified to say these will deliver what we're talking about? As far as I know, there are two of them. The first one, I think, which is more readily available, is called Align. It's spelled ALIGN. You can get this at your local Costco, your Publix pharmacy, your CVS. It comes in little pills, usually 1 pill a day. What does it do? Well, they contain what we call freeze-dried bacteria. So you're not actually ingesting fresh bacteria. What you're ingesting is a pill, just looks like your Tylenol. You swallow that, it is able to withstand the acid in your stomach. It gets into your small intestine and releases this good bacteria. So that's one that evidence supports. The second one is something called VSL number 3. So V for Victor, S for Sarah, L for Lou. It sounds like a futuristic drug. This is not as readily available, and I think it's mostly because you need to refrigerate it after you get it. So we know that these two probiotic pills come with a lot of evidence to say that these will work for you if you need a probiotic. So those are probiotic supplements. It's kind of like a vitamin. If you're not able to get enough in your diet, you can get it in pill form. But for those of you who say, well, I don't want to take another pill, is there a way to get these good bacteria naturally? The answer is yes. Fermented foods will help with this. So fermented foods like sauerkraut, kefir, tempeh, which is a fermented soy product, at your local grocery store. In fact, I got some Trader Joe's the other day. And so these foods will also be able to give you the good bacteria that your gut needs. So the question then becomes, who needs a probiotic? So again, remember what probiotics are. They're bacteria in your gut. And when you're born and if you eat a healthy diet and if you get good sleep and you get the required amount of exercise, your body is actually primed to keep these bacteria regenerating. What do I mean by regenerating? Think of them as little organisms, They have children, they have grandchildren, they have great-grandchildren. There's a whole population, a whole country in your gut helping you move things along. And so over time, though, it's just kind of like if you have a car or if you have a house, right? It looked fresh in 1995. Now, not so much. Your sink is leaking, your roof is leaking, the floor creaks. It's the same thing with your gut microbiota. Over time, some maintenance is needed. Let's say you have a house and there was a hurricane and the roof blew off, right? What does that mean? It means you need to replace the roof. What's the hurricane version to your gut? What if you went on vacation and you got a gut infection? What did that gut infection do? It's the equivalent of a hurricane in your gut. It flushed everything out. You might need in that moment, over some time, to repopulate your gut with probiotics. Those are the situations in which I recommend it for my patients. You're recovering from a gut infection, or you have an inflammation condition, maybe Crohn's disease, maybe ulcerative colitis, maybe celiac disease. These are things that disrupt the natural protections of your gut and makes it easier for the bad bacteria to hang on. And so in those situations, I would usually recommend that my patients try either a probiotic supplement or probiotic food if they would like to eat that. Now, when should you not do probiotics? Very important. If you have an immune system that is compromised, remember these probiotics are bacteria. If it's going to be easier for this bacteria to travel through the lining of your gut and get into your bloodstream, you don't want to try a probiotic. Why can my immune suppression be suppressed, Dr. Okoro? Well, if you're taking drugs that suppress your immune system, your doctor would have had a conversation with you about that. One of the popular ones is a steroid medication. You don't want to take a probiotic in this situation. If you have a medical condition like diabetes, that decreases your immune system. You want to have a conversation with your doctor. If you're treating a malignancy, if you're on chemotherapy, you don't want to talk a probiotic. You want to discuss that with your doctor first. So, let's reiterate. What are probiotics? They're good bacteria. These guys, they are the people you want in your gut. Why? Because they help your gut function better. They help your brain function better. How can you get a probiotic? You can take a probiotic supplement like Align or VSL number 3 because we know that these have evidence back behind them to say they actually do what they're supposed to do. Well, I don't want to take a pill. You can get foods that are fermented like kefir, tempeh, or pickles or sauerkraut. These have good bacteria help to repopulate your gut. When should you not take a probiotic? If your immune system is compromised. Medications like steroids can do that. Medications like chemotherapy, certain illnesses like HIV, things like that. If you really want to take a probiotic and you have these conditions, you have to discuss with your doctor first, and they'll give you more information on why you should absolutely not or why you can try them. So, I know this is a lot of information. And again, this is an evolving area we don't know. But if you have a question, please shoot me a message. I'm so happy to help you along with your health journey, and I'll be happy to respond. Be well. Much for watching. If this helped you understand your gut even a little better, go ahead and share it with someone who needs it too. And remember, your gut is more than just digestion. It's your second brain. And when it's off, everything feels off. So take care of it, trust it, and I'll see you in the next video. Don't forget to subscribe and hit the bell so you don't miss what's next. Be well.